of you're not just at the mercy of the pain, you can actually change it a little bit. It won't be as much as you want it to be, but the ability to...
You're listening to In Your Pants with Dr. Susie G, the physiotherapist for your private, helping you get in the know, down the low.
Hi friends, Dr. Susie G here, and welcome to another In Your Pants podcast. Thanks so much for being here. So on today's show, we are going to be diving into practical, modern neuroscience-based techniques that can help you recover from pelvic pain. And to help me talk about these strategies, I have a very special guest. Her name is Dr. Sandy Hilton. She is a good friend of mine and also a mentor of mine when it comes to pelvic pain and contemporary views on treatment approaches. The best thing about this conversation that I had with Dr. Sandy is the hope for recovery, the encouragement that recovery from pelvic pain is possible, and it's possible to do that without sacrificing the things that you love to do the most in life. So we talk about pelvic pain from that framework of hopefulness and building not only tissue tolerance and resilience and adaptability, but also mentally to get into that mindset of I can recover, I can get better from this. So to formally introduce Dr. Sandy Hilton, she is a pain and pelvic health physical therapist currently in Chicago at Entropy Physiotherapy. Sandy works in the clinic and online to help people with pain recover and is an internationally invited speaker and instructor of other health professionals. Sandy teaches classes on manual therapy and sensory integration techniques that are purposefully non-painful and help recover tolerance to activities such as sitting, bike riding, and sexual function. So Sandy also shares with us her most recent, she calls them her pandemic babies, 2 books that she was working on, and the links will be in the show notes as well. I highly, highly recommend that you check them out. One of them actually comes with a bag of balls, so I know Sandy would appreciate that, that little pun, but no, in all seriousness, it does come with a toolkit, which is a sensory integration toolkit with one of her books. So please do check that out. And if you found this show helpful and the information on this show, please be sure to share with people in your life because you just never know who might really benefit from hearing this conversation. And if you did like it, please be sure to subscribe, write a review, send me a message or Sandy a message, and let us know. Let us know what you thought of our conversation today. So I hope you enjoy the show. Sandy, thank you so much for being on the show today.
I am so happy to be here.
Yes, because we've got some really amazing topics to talk about, and really about, I think, for pelvic pain, particularly hope and recovery. And that's one thing in your bio that I admired, when you wrote, like, I help people recover and get back to doing the things that they love, like sitting and biking and all those fun things. So,
right?
Yes, absolutely. So let's maybe kind of set the stage for folks as far as the experience of pelvic pain itself. Like, it's really challenging. And in your course that I took with you, I remember distinctly saying, pelvic pain is pain plus, keep going. Can you expand on that comment that you made, and why is that?
I think that the pain itself is challenging, whether it's in your hand or your foot or your nose, where, pick a place. It's by design, if we can say that, something to get your attention and get you to change something. If you have a rock in your shoe, it gets your attention, you take the rock out. That's important and and necessary to know so that you can do the thing you need to do to get better. And the weird thing about pain is when it doesn't go away. So say you had the rock in your shoe, you're like, oh man, there's a rock in my shoe, and you take it out, but the pain stays. That's who we end up seeing in the clinic, because if it just got better, no one ever comes in to say, hey, check out my pelvic floor, it's fine. That would be weird, but also it doesn't happen. So we see the people that didn't get better. There's a lot of things. You could be hiking and sit on something really sharp, get a pain in your left testicle and have it, resolve in a little bit and longer than you want it to take, but also gone. Yeah. Or all the guys that get kicked with soccer balls. Yeah. Hurts, and then resolves. When it doesn't go away, we need to find those things that can help that system then finish the healing process so that it does resolve. And that's our realm in therapy. Really a lot easier if it's your knee or your back or something you can show other people. One of the challenges with pelvic pain is that we can't see it. You can't see pain anyway, but you can't see the part that hurts because oftentimes it's inside. Or it's a piece that is just socially awkward to compare with your friends.
Right.
Guys have a little bit easier. Many of those things are external, but rectal pain isn't.
Right.
And just that weird, somewhere nebulous between the rectum and the base of the penis, but deep inside kind of that you can't even find, but it stops you from being able to do anything like sit or have bowel movements or have sex. Little important things in life. And then the other thing is that's hard enough. So pain's hard. That's hard enough because logistically it's a challenge and it's socially awkward. But then also there's religious and cultural things. And who can you talk to about your rectum hurting? And who can you talk to if your testicles hurt when you have sex? And are you old enough to technically be able to have sex? Just strange, and who are you having sex with? And, so there's all of these cultural and social and religious and access to healthcare. Because Susie, you and I just sitting here together on a podcast represent a large proportion of male pelvic health therapists in the country.
I know. That's true. There's a huge gap. Yeah.
Yeah. We need so many more people for guys to go to that aren't fluffy little clinics in pastel colors for women's health.
Yeah.
Because that's awkward. It's like, so here you're a 23-year-old guy just come out of CrossFit and needs to go to your pelvic health appointment, and it's the women's health clinic with pregnancy pictures all over the place.
Right. I just had a gentleman reach out and say that same exact experience that you're describing here, saying like, I felt so awkward. It was a obstetric, eccentric feel. And he's like, I'm sitting in the waiting room with all these pregnant people. And I felt really awkward. And then, going into that session, it feeling like I don't belong. And how do I feel, how is this, what am I doing here? And I'm really nervous, kind of.
Which makes it harder because we know some things about the pelvic region, and stress and feeling uncomfortable is anti-helpful for getting better, because we're wanting good diaphragmatic breathing, nice relaxed pelvic floor, relaxed abdominal wall, these things that don't happen when you're feeling awkward and like you don't want to be in the room you're in. So that would be what you do if you want to challenge it and say, okay, now I'm going to take you into the most challenging setting, get into like graded exposure and go hang out with these people and see if your pelvic floor can be relaxed. But you wouldn't want to start there.
Right. Right.
That's more advanced challenge.
Totally. Totally. Well, and speaking of graded exposure, so that's a wonderful segue because you mentioned it. So we'll just dive into that. Mm-hmm. For our listeners who don't know what that is, could you explain the definition of that and the science behind it? And maybe, you've already mentioned a challenge, but how could we work within that spectrum of graded exposure to build up to maybe some of those more challenging situations?
Yeah, and that's the key of what we do every day in the clinic is progress. The easiest way for me to describe graded exposure is how you would learn any skill. Like if you decide you're going to pick up basketball, you don't go start with a whole tournament. You would start with maybe a half hour of learning particular drills, and then you'd start combining them and put them together. We start the science behind it. Most of it comes from sports, but also some of these things come from athletic trainers, from sports psychologists, from Olympic level progression for recovery. I take a lot of ideas from the professional running groups because so much of that balance and coordination and control, and you get that built-in progression of how I'm going to start. I can like a couch to 5K. I can't run, but I can start doing 1 minute intervals and then gradually improve. That's a graded exposure to the load and endurance needed for running. For pelvic situations, it depends on what the problem is. I've had some fun. They're a little easier to do graded exposure to getting back to playing golf than you can easily say, hey, I made it 3 holes without my shoulder hurting. And then next week I made 4 and look, I can see my progress. The little harder when it comes to things like, it hurts after I ejaculate. It's like, well, you can't only partially ejaculate. You have to just do it. And then how many what's normal repetition? And so sometimes pelvic stuff is principle, not necessarily protocol, because we're adapting how tissues heal and how we can progress sensibly through challenges. Sometimes it's more imagination and creativity than any particular protocol we might have.
Right.
But I've done graded exposure to sitting. So say your job is as a lawyer and you need to be able to sit and stand and walk around the courtroom and sit while the other side is presenting and not be squirming around. Look confident, all of those things. And yet it hurts really bad. So we've done graded exposure to sitting. Classically starts like, how long could you sit in a chair similar to what you'd be in the courtroom before your pain came on? And it'd be like, well, I don't even think I can. And I've had people like that. It's like 0, you can't. As soon as I load my butt print is what we very unelegantly call that here. As soon as you load, it starts to hurt. So then we start with imagining sitting. Can you even see yourself sitting in that chair without hurting? And some people are so wound up and their nervous system is so hypersensitive that even thinking about doing it makes it feel like it's too much. And that's nerves. That's not pretend. That's your nervous system. So then we go, okay, well, that's where you are. So then you'd be like, get in your most comfortable position. Feel the best time of day, most comfortable position with the people you enjoy being around the most, music that you like, stack up all the things that feel good. And then imagine sitting in the chair. And just have a chat with yourself that if you get rectal pain, imagining sitting in a chair under that condition, that that's a protective response that's way too enthusiastic. And so we unhook the thought from the pain. And then you have, okay, so the graded exposure to doing it is, I've used the AirX pad. It's like a 2-inch thick squishy thing. I've had people put that, we've held it up against the wall and then they just kind of lean their butt back into it and then come off it. So you're not, the best I can do in gravity, right? It's like, I can push my hand into your sit bones, but that doesn't hurt. Then we got to load it another way. So we can do that where you're kind of like twerking the wall a little bit. But then also to sit, take a breath, stand back up.
Right.
And then go do something else. And we could start there and then gradually increase the time. There are rules that come from chronic regional pain syndrome studies of if you're like, okay, I've made it to sitting for 10 minutes, and then you have this day that's just horrible, you don't have to start over. You could drop down 2 levels to where it's It's not even what you just did. It's a little further back than that, and do that. And then continue on. So you don't have to start over when you flare up. You just drop back a little and keep going. And that's building tolerance in the nerves in the area, and building trust in your own self that it's going to be okay. It's hard, but it's absolutely doable if you get it right.
Right.
And that by get it right just means it's something that your body accepts. Because sometimes it's like the therapist can come up with this fabulous idea that helps 15 other people, and you're like, yeah, I don't like it. It's not, you don't have to like learn to it till you like it. You just find something you do like.
Right. And that takes some patience, I think, for the process is what I'm hearing too, to time, patience, flexibility, mental flexibility, to
Courage.
I guess, courage. Yeah.
Yeah. But pain's just hard. It hurts. It's exhausting. You don't know that it's going to go away. You hope that it's going to go away. I think, and some of the researchers I know that's what they do is study pain, have said things that just make me laugh, because they're like, it starts to, you're doing some volunteering for studies and things, and you're supposed to say when the pain's intolerable, but if you know it's a study situation and you're like, I can deal with more. Are you really a normal subject? Or are you like, it's just pain, I'm fine? Because you know it's going to stop, which gives you a lot of courage. But when you don't know it's going to stop, a sensible person would be like, please make this stop now. It's horrible. And it changes the way you think about it.
Right. Right. So, Sandy, what advice can you give to people as far as maintaining that encouragement, the motivation, and the energy to keep going, even though it's hard?
Stack up the wins, and surround, really find things that are purposefully pleasurable. I think that's something that I didn't used to sell hard enough, to push hard enough, to encourage hard enough. Of do something every day that you enjoy, that you love, that feels good, or even just less bad. Because that dopamine and serotonin and oxytocin and the control of I chose to do this thing that feels good is really powerful in yourself. Of you're not just at the mercy of the pain, you can actually change it a little bit. It won't be as much as you want it to be, but the ability to control something is really helpful. So I would say find it. I like asking people like, what does better mean to you, and how will you know when you're better? So it's not me telling you you're better. It's how would you know? What does better mean? And then we set those up like little signposts of, look, we're closer to that you're aiming for, and here's how we can measure it. And I think that's really important, especially when it just feels like I'm not any better.
Right.
And that's the power of things like Couch to 5K. You're like, I still can't run very well. And you look and you're like, oh, wait, I'm running for 10 minutes, 10-minute things instead of only being able to do 2 of them. And even though it's still hard, I can see the progress.
Right. That's such an important point to tie in, doing these things or treatment, any treatment that you're doing is to track the changes that you are noticing, even though they're little bits at a time. Small actions lead to big effects. It's like being able to recognize that and have someone that you're working with celebrate those victories, no matter how small.
We do. We get to celebrate all kinds of things. Like I had a bowel movement, it didn't hurt. Yay! That's fabulous. Because it's very distressing when I had to go have a poo, and you're going to hurt for 2 hours afterwards.
Yeah.
That's exhausting. And when it's no longer true, then it's a fun thing to say, how many times would you need to do that before you believe that that's your new normal?
Yeah, good point.
Because we're so good at being like, I never want this to happen again, so let me be on high alert.
Yeah.
But that high alert is actually not really helpful. So that's why it's hard. It's doable, but it is challenging.
And just even acknowledging this conversation we're having, and having this conversation with people who are in pain, and even just with our own selves. With myself, I know it's even hard, you know these things from a different perspective, but it's so challenging practically to be like, oh yes, I remember this. Yes, let me just relax around this.
Okay.
Yes, it's gonna be okay. Because the initial instinct is like, I'm freaking out. Like I'm freaking out.
That's where which is sensible. It's just not supposed to be sustained, and it's to get you to assess the situation. It helps to know. So we just don't get enough good biology information, and the things we're learning about pain now are way better than we knew 20 years ago. So we know pain can change. It can. We know that you're not fragile, you hurt. You're not broken, you hurt. And we're to treat the pain. You don't have to give up the things you love. We might just have to be creative about how we get back to them.
Right.
And I think that's a difference over the last 20 years. When I started PT 500 centuries ago, the treatment for back pain was, let's do a lumbar laminectomy, and then you have this big brace on, and there's all these things you can't do for weeks. And we know that that's not the way to go now. So the science changes, our treatments change. I hope that 5 years from now, I'm doing things a little different than I am now, because we've learned more.
Right.
And that excites me, because I think we can help people faster. No one's got time to hurt like that.
Of course. I wanted to take this conversation about graded exposure to talk about like that example you used earlier of, I have pain with ejaculation. Would you be able to share with us kind of some examples of how we would apply graded exposure for someone who's experiencing perhaps that issue? Because you're right. How do you creatively try to work with tissue resilience, tissue tolerance, calming things down, building things back up, that sort of thing with
you have to, you can't do part of a task. It's all or nothing. Right. So you get to do does even thinking about it hurt, so that you can identify if we just need to disconnect the thought from the protective response and start there. And then, can you get aroused and let that fade? Does running that arousal system, is that clear? And if not, then you practice that and let it fade. And then like I compare it to diving. It's like at some point you have to just dive. You can't dive halfway. So there's things you can do to prep the skill and practice all the different components. But at some point it's going to be do it. Then what of the things that you have done before you go ahead and try the skill of ejaculating that help you recover when you hurt? Right. So I'm working on getting back to running again. When I go for a run, I'm going to need to come home and do some things to recover. And I know what they are, and I trust that they will work. That, I think, is a really critical thing to help people have before you ask them to do the hard thing, which would be, okay, go ahead, not only get aroused and ejaculate, and then recover afterwards, so that you know that it can. And we unhook that it's always going to hurt and turn it into it might.
Right.
Like, it might hurt. And if it hurts, there's things I can do to feel better. So you need that part, because then you have the courage to be like, okay, it's going to hurt, but it's not going to last forever.
Right.
So can I do it? And then I think the next step after that is, what's normal ejaculation frequency and whatever? I don't know. There isn't really. No one's done that study.
Right.
If someone would like to get 1,000 guys with no problems and figure out what normal, it's probably a really big range. So it's like, I don't know, maybe ejaculate and then recover and do other exercise and get your heart rate up and do things you love and be aroused about other things. And then make up a number of days later to try and see what is the frequency with which you can do that. what's your normal? What is your goal? What are you aiming for? How will you know when you're better?
Right. Right. Beautiful.
Yeah.
That's a beautiful progression of starting somewhere and taking that first step.
Start somewhere. But I think that the most important thing is, do you have the tools and the confidence in your tools for when you have pain to recover from it? Because that gives you the courage to do it again.
Yeah. Right.
It's going to take reps. I don't know how many. So get started.
Right. Let's not get hung up on the number.
Do it again.
Right.
Yeah.
Do it again and try again. And knowing that you're not causing more harm or damage, I think it's
actually normal for the tissues. And it's healthy for the tissues. That's why your body has the nighttime erections. You're flushing those really important, very tiny blood cells. The spaces in the penis need a good flush of blood to keep the spaces healthy. So it's actually really good for it. And ejaculation and orgasms, fabulous for the pelvic muscle contraction and relaxation. They're really healthy. But like anything, some is good, more is not necessarily better. Tons of stories from being married to an Army guy where guys would be gone for an 18-month deployment and come home and have sex a lot and be sore because it's delayed onset of muscle soreness for some things you haven't been using for a while, and you're going to need to work on some recovery time.
Exactly. Expectations, right? Yes.
Which that's just normal.
Right.
And it's not a pathology. That's like, dude, you went from 0 to 800.
Thank you. Yes. Thank you for saying that. And that's with anything though. See, why would it be different for this part of our body and this particular function? It would not.
Absolutely. It's like when people my orgasms need to get better. And I watch the thing online and I know I can do Kegels and get better. And they do. I'm not picking on the guys here because women do it too. But it's like, if 10 is good for normal humans, I'm going to do 4,000 and then I'll get even better. It's like, no. You're going to get some sensitivity and some soreness and probably a little muscle spasm that's going to need to be recovered.
Exactly. Right. And man, when that happens and you don't have this knowledge or this understanding of...
It's scary.
Absolutely. Because you're like, oh my goodness, what's going on?
I broke me. Right. And now it will never work again. And I'm stuck like this. All intuitively sensible and wrong.
Yeah.
But if you don't have the knowledge, or you can't access someone to help you if you can't do it on your own, then that's a whole nother set of problems, which is why we need more people who can help the guys.
Agreed. And I feel like if this information were shared sooner than later and this understanding was standard, for any practitioner you saw.
Sex ed in high school, we should know this about our bodies.
Yeah.
We should just know this about your body. It's like, if I do 700 bicep curls, my arm's going to hurt.
Right.
If I do 700 Kegels, my ass will hurt. I hope I can swear on your...
You can.
Okay.
You totally can.
But it's like, you got a cramp in your foot, you stand on it. You get a cramp in your ass, you need to put pressure and movement through it.
Right.
It's just logistically a different place that's got all of that social and awkwardness to it sometimes that needs to be dealt with.
Mm-hmm. Absolutely. Well, I would love to first ask you where people, if they want to learn more about this treatment approach, and let's say they're working with a pelvic therapist who might not be addressing their pain or their concerns in the way that we're talking about, right? Because there's just different spectrums of approaches and
absolutely
theories and so forth. So how would a person bring up, graded exposure or trying these treatment ideas, especially when it's around sexual function and erections or ejaculation, that as you can imagine, might be a very vulnerable space to be in as far as asking, talking about those things and bringing them up and what can I do for this? in this graded exposure kind of way? I think there's a lot of questions in that one, everything that I just said right now.
If you're seeing a therapist and you want to talk about anything, it's like, hey, I saw this online and what do you think about it? I think is a fabulous way to just say it like that. Because I'll have people come in, I learn so much from my patients. Like, well, have you seen this tool or do you know this person's program? And like, well, no, thank you. And I go look it up and learn more. Because it's always another way to try. And I think that it's actually a gift when someone shows me something I didn't see before. It's fabulous. So you can give that gift to your therapist and say, hey, I saw this or I heard this. What do you know about it? And can we try some of it? Because I'm curious to see how that would go for me. It'd be fabulous. And they should be like, all right, let's give it a shot. Because there's a lot of different ways to get better. And our job as therapists is to help people not need us. like I want to help people develop independence, be able to do it on their own, and then just check back in for tune-ups if they need them.
Right. 100%. I'm with you. It's I think you said this before. It's not a good business model, but
Peter O'Sullivan stole it from him. Good for business, bad for health.
Yeah.
But is when you're like telling people, oh, you got to come back every 6 weeks so that I can make sure you're okay.
Right.
But the things that are really good for health may not be the best. Although I firmly disagree with that, because like you get some of my best referrals come from people who used to have pelvic pain. And they'll run across someone, hear of a guy at work that's having a hard time, and just say, I used to have that problem, is the most powerful thing a guy can hear. Because if you go online, it looks like this is your life forever and it will never get better. Because the people who got better are off rock climbing and on cross-country motorcycle trips. They're not posting on Reddit.
Right.
And so you don't see them. And it's fabulous to be like, oh yeah, I used to have that problem. I got better. Here, go talk to this person. Is great. They're out there. We need to get them to write more blog posts and get on more things. So more people can see that recovery happens all the time.
Yeah. I love it. Thank you for saying that, because that's a message that is, as you said, far in between as far as availability on the Google searches and forums and so forth.
It's true. And it's just because they're out having fun. They're not purposely not sharing what they work for them. It's that they spent so much time and money and doctor's appointments and imaging and physical therapy and home program that finally they don't need it anymore. And they're just like, summer vacation. And you're not. Let me write a blog post is not your first thought when you're suddenly out of pain.
Yeah.
Unless you're like me, but that was fabulous. Let me write that down.
Right. Right. Oh, yeah. Such a hopeful message. Such a hopeful message. And I know there's more messages coming because cat's out of the bag. You've got some projects that are going to be coming out on the horizon. Can you please, shameless plug here, Sandy, talk to us about these.
Plug. So my pandemic baby was writing a book that is going to be on treatment of pelvic pain, and for people, for humans that hurt. And it is self-care for pelvic pain, a sensory integration toolkit, and it's going to be available from OPTP in November, depending on how soon it comes back from the printers. And it will come, so it has all of this, the graded exposure and how to find pleasure in your body again. And it comes with a bag of different size and textures of balls to use.
Comes with balls?
For some of the sensory integration work and graded exposure to pressure. So it comes with them. So you don't have to be like, I got to go find this ball and not be able to find it. So that'll be fun. And then the Why Pelvic Pain Hurts that was published a few.
This is the first edition. So
second edition will be coming out soon. We just updated things based on the research as we know it, and a little better understanding about, the thing where you sit through your class and you're fine. And then 2 days later, you hurt really bad. We know so much more now than when that book was initially published of why that happens and how it's really okay. And it's like, oh, that's what's going on. And we know how to address it. I'll give you a hint, do things that feel good. Because it's your neuroimmune system and it really likes pleasure.
Yeah.
So be a little hedonistic and do something every day that just feels good. It's very healthy.
Yeah. And it sounds like it really doesn't matter what those things are. Like, I feel like there's so much emphasis on, you got to do this particular stretch in this particular way or this particular manual therapy, and it has to be done. Like, this is such a, I think, revelation. And I think it should feel relieving for a lot of people to say, like, we can actually keep it simple and do things that you actually like.
Right? I mean, how cool is that how do I know if I'm doing it right? Do you like it? Like, yes. Does it feel good? Yes. Excellent. Carry on. But the beautiful thing that I love, and I have friends who love yoga. They find yoga to be a spiritual, comforting, wonderful, freeing strength, power, endurance, all these fabulous things. And they really love it. And I have other friends who really don't. And the beautiful thing we know about the research is that you don't have to do the thing you don't like to get better. You can go do the things you like to get better, which is so cool because so much in life seems like, oh, I got to do this.
Yeah.
And what if treating pain works even better if it's by you choosing the thing you like the best? How cool is that? And then having fun with it. It's
awesome.
Yay.
Awesome. And it simplifies life. I think there's so much pressure, I think, to take something so complex like our biology and to oversimplify it into just like, okay, it's a muscle problem or it's this problem or that problem. And it's like, wait a second, let's, and this is what Lorimer Mosley and the master sessions in 2022, they emphasize. So for those who don't know who Lorimer Mosley is, pain researcher and a mentor of mine, and I know of Sandy's and a friend who mentioned, like, we need to embrace the complexity of our biology. Like, our biology is complex and it changes, and we don't have to like make it overly complicated. Actually, we could just get back to the simple things. I'm paraphrasing.
Yeah. No, I think that's beautiful. And how do you know it's a good choice? Do you like it?
Right. Exactly, Sandy. Exactly. How do I know if I'm doing it right?
Because I'm like that. I mean, that's very much me. Is this right? Do I have it right now? Could it be more right?
Yeah.
It's like, could I like it more? What a concept. Yeah. It's really neat.
That's powerful. That's really.
And I think in pelvic health, it's even more because, as Dr. Melissa Farmer said years ago, peeing, pooping, and sex are all supposed to be pleasurable. So that whole region is supposed to be rewarding. Mm-hmm. And when we hurt and we can't use it, we're being robbed not only of not hurting, but also of something that's supposed to be pleasurable. So probably super extra powerful to do pleasurable things with that area. Mm. Which I just think is nice. I mean, if it's going to be more complex, it gets to also be more pleasurable.
Exactly. Oh, it's such a powerful message. Thank you, Sandy. Yeah. I'll definitely make sure to link the books when they become available to the show notes. So for anyone interested, please definitely check it out. And also, Sandy, if folks wanted to connect with you, where can they find you? How can they connect with you?
They can find me through the Entropy Physiotherapy website. So it's entropy.physio. And you can hook up to my email from there. My email is sandy@entropy.physio. You can also find me on Twitter. That's the social media place that I hang out. Find most of my good research and bad jokes, that kind of thing. But always open to just shoot me an email or find me through the website. I have happy to consult with therapists that are like, I want to hear more about this, tell me, or patients that have questions. The internet is a fabulous thing. We can use it to share information.
Yeah. Well, thank you. Thank you, Sandy. And thank you so much for being on the show and sharing your wisdom with all of us and your humor. I always appreciate it.
Thanks for letting me swear.
Yeah, of course. Anytime, anytime. And for all of our listeners and viewers out there, thanks so much for being here. And as always, in loving wellness for your pelvis, this is Dr. Susie signing off until next time. Bye.
Thanks for listening to today's episode. Be sure to head on over to drsuzyg.com where you can get more information, show notes, and related articles on today's topic. Also, if you like what you're hearing, head on over to iTunes, subscribe to the podcast, and leave us a rating and review. We'd love to hear feedback. Thanks again.